Yes, thank you, Miss Amanda, for the music. So it's about time, and before we begin, my apologies once again for starting the meeting late. Like I said, it's due to technical challenge which was beyond our control. So while we still wait for that persons to catch up with us, it's my pleasure to let me just do this just for those who should see what I look like if you have not seen me. Okay, so we have in our midst the CEO of Nimedix, Dr. Shoshe, and also our amazing host, Mrs. Fulfill Joy. So I'm handing over the meeting to her.
All right, thank you, Mr. Gilbert. Good evening, everyone. Trust we had a beautiful day, and and I hope you are not a bit upset with us because we apology cannot actually be too much. We still need to keep apologizing for starting quite late. It's actually an hour beyond the scheduled time, so we are so sorry. So, without further ado, let's move to the BOD, the business of the day. So, good evening, everyone. Good evening, Dr. Choshe and Mr. Gilbert, Miss Naye. Good evening, everyone. Please, if I'm not able to call your name, don't feel offended. Don't get offended. I'm so sorry. I really can't start picking everyone's name. And a big thank you to everyone that registered for this program. So yeah, without wasting so much of our time, Dr. Ochoshi, are you there, sir?
Yes, I can hear you. I'm here.
Okay, let's have a brief intro into the world of Nimedix. What is Nimedix all about, and what's actually brought about the vision of Nimedix?
Okay. Thank you very much for the introduction. And whenever I have to talk about Nimedix, I always try to say something before we start. I will I will bet I will bet nearly everything in my wallet that nearly every one of us here in this meeting have had one or two things to do with the hospital since we were born. Till this point, we've been to the hospital, and I would also bet that the experience has not somewhat been pleasant, or the experience is not always pleasant. The issues around healthcare is not strange to nearly anyone in Nigeria. We all know the challenges around healthcare in Nigeria. And for me personally, how Nimedix came about, um, I just finished secondary school, and my elder brother was very sick. It was a doctor's strike that time. Resident doctors were on strike, and I think doctors generally were on strike. So some way somehow I lost my elder brother, and I was very very furious. I the only doctor that was on call, seeing so many people I could remember at Federal Medical Center Makodi. After his death, I I met the doctor and I told him that even if I am 90 years old, I am going to write jump and I'll apply for medicine and I'll become a doctor someday. And that was what happened. For the next 7 8 years, I was writing jump. Even if I get something else to study, I will turn it down. I have to study medicine. And I ended up in Benue State University Teaching Hospital, spending a very long time there again because I was very, very much distracted. And the school did not have accreditation at some point, so stay there was very, very lengthy. So, in all, for the past 20 years, I've been chasing medicine. And in these 20 years, somewhere along the line, I lost my dad as well. Just before I started medical school, I lost my dad. I started staying with my uncle. Unfortunately, he passed on as well. Health issues. He traveled to India here and there. Spent loads of money, but he still did not make it, unfortunately. So I've been in the healthcare space either as a user and a professional. Um, Immediately I started medical school, I volunteered myself for medical outreaches. I've traveled nearly across Nigeria for medical outreaches with my teachers and my mentors. Um, so for for Nimedix, that was just my journey medicine. So for Nimedix, somewhere around my fourth year in medical school, I I was shocked by statistics I saw. I saw it on, I think, Reddit. It says that in a doctor's lifetime, you could only see approximately 60,000 people in your lifetime. That is, if you work from the ages of 25, from age of 25 to age of 60, if you work day and night non-stop, you only see 60,000 people. So for me, 60,000 was not enough because I can't spend 20 years chasing a degree and me being able to impact 60,000 people is a probability. It's not sure. So I said no. I had to think of some way else that I would make an impact. So Nimedix was born. And the idea behind Nimedix was to make sure people don't suffer what I have suffered in terms of accessing care, quality of care, and cost of care. Because at some point, my dad was very sick and stayed in the hospital for long, National Hospital, Abuja, and it ran my family to the ground. We spent nearly everything we had, sold properties to pay medical bills because there was no, he had no healthcare insurance and all of that. So I've had a reason to interact with the healthcare space on different at different levels, and the experience is painful. My situation is even, I would say, not compared to what is existing out there. It's far worse out there. Um, I would like to bring in some numbers again. Nigeria is pushing on upwards of 210 million, 220 million people, and the number of doctors keeps shrinking. Though it's a global problem, the time it takes to produce or to make a doctor, it's it's getting longer because not many people are willing to go through the rigors of medical training. So the number of doctors globally is reducing, but for Africa and Nigeria in its peculiar nature, is far worse. So I mentioned that we're about 210 million to 220 million from the last data I know, and there are just about 30,000 doctors in Nigeria today, and that number is falling seriously. Every day you turn on the news, you hear doctors are leaving the country, um, doctors are leaving, a problem there. So WHO standard says to every one doctor there should be 600 patients, but in Nigeria the ratio is 1 to about 9,000, and in some regions in Nigeria that ratio is even out of it entirely, as some communities do not have medical doctors altogether. So Nimedix had to be born out of all of this experience, and over the years we've been modifying um, to address real time issues, not just another tech product you just download and and have a feel of what tech can do in healthcare. No, we want something that will actually impact people, not impacting um, to not impacting to raise revenue or make money from users as an ultimate goal, but to really reach out to people. So our design had to embrace blockchain technology and what it can do, and artificial intelligence, um, amongst other things. Now, I'll just keep it at that. I don't want to talk about tech so much, but this is what Nimedix is about. We want to bring healthcare to to the people of Nigeria, and we understand that healthcare challenges are never in isolation. Issues around healthcare will bother around cost, will bother around unemployment and poverty, will bother around education. So all of these issues we had to factor in and come up with Nimedix. So in a nutshell, Nimedix is more like an all-in-one solution, like an all-in-one solution. To with a platform, you don't need to go here looking for this, go here looking for that. That's why we call it an ecosystem, because we want to incorporate a little bits of everything that is relevant to the African society, that is relevant to Nigeria as a people. So that's what Nimedix is about. See, talking about the technology, Nimedix, we are centric, or we are focused on both doctors and patients, and what makes Nimedix unique. My experience, and what is happening in the um, globally, what is happening globally, we had to come up with something that will survive. Um, I'll give an example. I'll give an example. I always say this when we have meetings or when we have to talk to people. Uh, Telemedicine is beautiful. I was in the phases of digital health and I talked about telemedicine, how cool it is, and all of that. But telemedicine is not enough for Nigeria. I always mention that. It's not enough. It can go a long way, but it's not enough. And why do I say it's not enough? For the Western societies, for the developed societies, the disease profile is quite different from what is obtainable in Africa. See, if you look at the distribution of diseases, in the Western societies, you have more chronic conditions, hypertension, diabetes, cancers, and all of that. I can call a patient and talk about diabetes. I can call a patient and talk about hypertension. And they can use wearables from wherever they are and measure their blood pressure and give me some vitals I can use in patient management. This is what's common in the Western societies. It makes telemedicine more attractive to them in the Western societies. But how about Africa? How about Nigeria, where you have um, conditions like infectious diseases that require a doctor hands-on? So the problem is not just that Africa holds almost one quarter of the global disease burden. It happens that Africa as well don't have enough doctors. Nigeria, painfully again, the number of doctors is just disaster waiting to happen. So for Nimedix, we had to factor all of these challenges in and say, okay, how do we address this problem of doctors and patients? So um, I was talking about telemedicine not being enough in Nigeria. What use will telemedicine be when a child is dying of diarrhea disease, which is one of the most common childhood killers in Nigeria and Africa? What happens when a woman is suffering from postpartum hemorrhage? I use that as an example again. And that simply means a woman bleeding uncontrollably after birth, uh, sometimes early, sometimes late. But these are the leading killers when it comes to killers of children and killers of women in Nigeria, and killers of um, conditions that actually kill more again in this space is trauma in the African society. Trauma, road traffic accidents, and all of that. So, what use will telemedicine be in situations like this? See, if we will design a solution for Africa, we must factor in African problems We don't need to bring about Western technology. We must factor in African problems. So um, other challenges like data handling, interoperability, and all of that, I, we always mention it in passing because that is also, again, not what will be impactful to to the society at the moment. It can be useful much later, but not at the moment. So, Nimedix, we described it as a Swiss Army knife. It has different facets. So we do a bit of telemedicine for the patient, and in this telemedicine, you can access healthcare, you can talk to a doctor, you schedule appointments, you can store your healthcare records. If you wish, that's on the blockchain. Your wallet is entirely yours. Um, that's the design of it. You can order drugs and it will be delivered to your location. We're starting with some locations, hopefully, and
Okay,
hopefully we
let me
spread
we'll get to all those
of
nitty
that.
gritty of matter
Okay.
later, but I actually like us to address some few points that I actually noted here. Actually, I noticed that if I actually left you alone, you would just be going on and on and on. But yes, I have.
Actually,
I actually noted some things here. Okay, now you talk about the medical bill. And I'm someone that's very familiar and very conversant with health insurance and using the HMOs and health policies. So, what particular solution do we have when we are talking about, one of the major issues that patients have in Africa, or let me just come home to Nigeria first, because this is our home, this is our country, this is where we stay, this is where a lot of the major complaints we are having is lack of medical facilities in this country, if I'm right. So, and the another challenge that is being faced by Nigerians is lack of finance to be able to fund their medical expense to some point that we now see some people going online to that for those that are even bold enough to try to go get some funds online. So what solution is Nimedix uh, providing when it comes to probably, let's say, maybe the spread of medical bills or probably an upfront payment? Because I know HMO is more of an upfront payment of your medical bill, and when you need it, you just walk into the hospital that you registered it for, and then you tell them that you are using this particular HMO, and they don't even have to bother to ask you for money. It all depends on the kind of policy you are being signed onto. So, what solution is Nimedix providing concerning this uh, medical rising cost of medical expense? Dr. Sese, did you get the question?
um, okay. Thank you very much for your question. I will. I just had to round up the questions to sum it up in two main questions. You mentioned lack of medical facilities, and you mentioned cost of care. Then you came down to am I correct?
Well, my main question is actually the solution Nimidex is providing when it comes to payment of your bill, your health expense, when it comes to you paying your medical bills and looking at trying to compare it with when there is when someone is subscribed
Hello.
for health insurance. Yeah, can you hear me, sir?
Okay. I'm really sorry about that. MTN is showing me how mighty they are.
It's
Sorry
one of the
about that.
sacrifice we pay for being Nigerians.
Okay. Yeah, there was a brief moment of power outage, so my Wi-Fi went off, but I'm back now. Um, so I can remember clearly you mentioned two things. I noted down. You mentioned lack of facilities, lack of facilities and rising cost of care, and what we are trying to
I
do
don't think
or our
actually comes from
solution.
lack of facilities. I'm talking about the cost. The cost
Okay,
when we are
healthcare
looking
insurance.
at healthcare insurance, because healthcare insurance is more like you are paying upfront,
Okay.
your
Yeah.
medical bills upfront. But
Okay.
a lot of people will want, okay, something to
I
stand in
know.
for them, probably want to spread their payment. So when we are looking at settling your medical costs, how is
Yeah.
Nimidex coming into this? What solution is Nimidex providing?
Okay. Thank you very much for your question. Um, what we did to that effect, it's going to hopefully change the way we look at healthcare insurance. Healthcare insurance before now has been a cost, a recurring cost for that matter. How about if healthcare insurance can become an investment? I'll give you an example. If you pay 5,000 naira for a healthcare insurance package this month and you don't get to use it, next month you have to pay again, next month you have to pay again, and you keep paying that. It keeps recurring depending on the category of your healthcare insurance. Um, the issue with this is that if you need healthcare insurance, there are some services and there are some drugs that you will not be able to access because of either the size or the amount, the type of healthcare insurance you have picked. If it is too small, you don't have access to certain drugs or certain services, and if you don't have the resources to step up to higher plans, that will continue to recur, and the challenge is still there, basically. But with cryptocurrencies, you agree with me that this or things can be done differently. If, for instance, Fulfilled has 5,000 naira worth or 5,000 NIM coins staked in her insurance wallet, that has automatically become her healthcare insurance from what we are doing. We're looking at it from that perspective where users can stake certain amounts for healthcare insurance. If you stake for 1 month, you should get some profit at the end of the month because um, let's say, for example, you don't fall ill. It means you're not going to need that money. So we think traditional systems of healthcare insurance will just, okay, keep the money. Where we think it's unfair because you are contributing to a system that is not giving you back. So what we are working on is still one of the products we are looking at carefully. We're trying to get everything right, and we are talking to traditional healthcare insurance companies to make sure we get it right first time. Is that we are creating specific wallets where users can hold their Nimedix tokens in the form of insurance. So if it is 1,000 you have, you keep it there. It's healthcare insurance and it's also healthcare investment because you can withdraw that and use. And at the same time, this insurance can also yield you can also yield, like get more Nimedix tokens that can be used to get better healthcare services on the platform. So it looks very simple, but it's actually a big solution because if you want to, for example, again, say my healthcare insurance is 10,000 naira, it is paid once. It's no longer recurring 10,000 naira. So that one 10,000 naira you had with Nimedix 5 years ago has added some value to the Nimedix token at the end of the day. After 5 years, you should be able to get some profit from what you have invested because you have staked that asset. So if we understand how the dynamics works with coins, if we have nearly everybody using the Nimedix platform stake their tokens, automatically the price will go up. Automatically, users can pay for even better healthcare services. So I don't know if this answers your questions, but this was the trick we
Okay,
pulled
it
off with the
actually
blockchain.
answers my question. It actually answers my question, but I have just this brief question on this path. which is the expense part. You said the solution is the healthcare, more like healthcare insurance taking, where they
Yeah.
will just a particular money. But by the time they put that money there, and you know how people are with money, and is it not possible for them to just kind of withdraw it to take care of other things? Looking at it, that when you give your money to the insurance companies, they you cannot go back there to say you want to claim it. It's not like a car insurance or probably a policy that you made on behalf of your kids. This is health insurance that we're talking about, and you know the health insurance. The only people that can claim the money from the insurance company are the hospitals. So is it not? Is there no way, like, once people dump this money there, will there be still be ways for them to still kind of retrieve it back and reverse it and say, ah, they have made some cool money, let them go and enjoy themselves, and at the end of the day when they need it, they will not have anything inside their wallet.
In the
So is
wallet.
there,
Okay. These are the fine details we are working with traditional healthcare insurance systems. I totally agree with you. It doesn't bring about accountability for what the money is supposed to be used for. Uh, so, how about this? If um, if I go further to explain, I may have to let out everything we are doing, which may not be appropriate. Um, it's letting out company secret. So if,
okay,
for
it's just
instance,
enough if you say you have provisions for all that. It's just enough.
yeah, yeah. So okay, if you have 5,000 stakes, for instance, for healthcare, and that is what you want to keep for healthcare insurance, and you don't fall sick for 5 years, or you never have a reason to use it for 5 years, and that has yielded some money um, for these 5 years. Let's say you have another need. Let's say you have another need. You should be able to use the profit, even if not the 5,000 naira. You should be able to use your profit from what you've yielded to say, okay, I need to take some of this money for this. Um, I'll talk about something briefly. I'll talk about something briefly again. The Dubai Center for Future Studies, they have built their healthcare system on 5 pillars, and these 5 P's is prevention, precision, personalization. What else again? I'll start with the prevention. Disease or healthcare issues are tilting towards prevention than treatment, and part of this treatment is adequate nutrition. These are determinants of health. You can have 10 million naira in your health insurance, and you are not eating rightly and fall with malnutrition and die. It doesn't help anybody at the end of the day. But if you can have access to certain bits of this five of this 10 million naira you have, it will go a long way. Um, Better life generally. We looked at this from a wholesome perspective that health is not just absence of disease or infirmity. It looks at everything for your well-being, which is also finance included. Finance included. So we are trying to actually bring about balance in everything. So that's much I would like to talk about that. But we are working with traditional systems to help us cover some of these gaps um, that tech can solve and improve on what traditional systems already have.
All right, thank you for that. Okay, now that we have sorted out the issue of cost, now we know that when it comes to sorting your medical bills, Nimidex is a check, and that is kind of, will I say, kind of puts a lot of people's mind at rest. So beyond them thinking, oh, they're about to make loads of money, they are looking at the solutions you are providing. So now to my next set of questions, which is about the patient, now addressing each patient. Everyone, every single person on this earth has his or her own unique kind of symptoms, or like there's a uniqueness to each person. And if the symptoms A feels for malaria might be different from the symptoms B feels for malaria. I was privileged to have some time of service at the laboratory, at some medical laboratory. So I could see when some people were sent in for tests, especially when it has to do with the retroviral test. And when some come for their result, they will be like, I'm not sick, I'm fine, there is nothing wrong with me. And meanwhile, they are supposed to have been seeing some symptoms, but probably they never saw anything. Let's just say, in medical terms, they were asymptomatic until probably maybe their T4 cells had broken down to some certain levels. So now, knowing that every single person has his own unique way of reacting to different kind of sicknesses, how do you now get like each person to have access to a doctor that will now be able to give solution to whatever is happening to them, and also putting into consideration majority of persons that are living in rural area that don't even have access to internet, let alone say they are getting a good phone to be able to access the internet, or to be able to call a doctor if they have the phone number of a doctor, or probably an emergency line that they can easily access a doctor. So knowing fully well that the everyone has a unique issue, what solution is Nimidex providing to so that the doctors that are on the Nimedix platform will be able to answer each person according to his or her own need?
Okay. Thank you very much for your question. Your question is actually very elaborate, and it's two-ended. When I mean it's two-ended, one end of the question is asking about precision medicine. If I get you correctly, every individual is unique, and that is the teaching even in medical school. There are no two patients that are the same. However, in treatment of certain disease conditions, there are groups of symptoms that may occur in one patient or two larger population, and you treat according to those sets of symptoms. Um, this is the challenge actually with Africa. This is the challenge with Africa. No, there is no part of this planet that can guarantee a one doctor to one patient kind of interaction. The only way humanity can achieve that feat is through the use of technology, and that is artificial intelligence. And that is where Nimedix again stands out different, because we are addressing that issue with a solution called clinical decision support system, where our doctors and our patients are like, okay, our patients can fill in their own unique set of challenges, and the doctor does not need to think about 1,000 patients having 1,000 different conditions because 1,000 of them are unique. He doesn't have to think about that. The AI will analyze and present to this doctor evidence-based either diagnosis, prognosis, or treatment. We're working with one of the best companies in the world, Med Algorithms, to design something specifically for for Africa. We've been on this for so many years now because we need to develop something that works for our environment. So as for that, any Nigerian or anyone that has access to a smartphone that can create a profile on the Nimedix platform will enjoy this artificial intelligence that if you if the doctor requests certain information, they can get it, and you get an AI guided solution from your doctor. Um, one of the key things we, one of the I talked about this on my Facebook handle. I met a very senior colleague, very senior colleague at the airport, and he was craving the use of AI, and he talked about it replacing doctors. And I told him that no, AI will not replace doctors, but doctors that use AI will replace doctors that don't. And that is exactly what you are asking. How are we going to solve that problem? This is what I just described in the last in the last statement I made. This AI is going to collect vital healthcare data and process and share with your doctor. So the doctor does not have to think and make mistakes with your diagnosis or prescription. Because come to think of it, if I see 100 patients and I want to claim that 100 of them are sick, if I have to think about 100 different conditions, if I ask any human being to do that, I am only looking for trouble because fatigue will set in, which is some huge problem Nigerian doctors are suffering again. Physicians burn out, doctors are tired, they make wrong diagnosis, wrong prescription. So the Nimedix platform has eliminated this huge problem. So doctors do not have to kill themselves thinking so much about every patient. So they can further study the journals from directly from the application or do further studies before even they get to talk to patients. So that's one end of your question. The other end of your question is how do we access the people in the village? For that, it's unfortunate that we will have to depend on internet penetration or smart mobile penetration. We made provision for USSD service delivery. So USSD meaning you could dial a certain number, or if, for example, Mr. Gilbert Jopata wants to help his village people with healthcare, he can just give the village headmaster a phone number and say his phone number and say, whenever anybody wants to see a doctor from this village, let them call my number, and we can patch that through onto Nimed and say, okay, let's talk to this person, and your account will be billed for that. So if Mr. Gilbert wants to share 3 million naira for his village people, and he decides to pay for their healthcare bills, they can go through his profile and we'll be able to see them. We'll be able to talk to them rather. Um, this is it. For some people, or as much as 80% of healthcare issues that appear in the hospital were at some point social problems where you could discuss either lifestyle modification, diet change, do more exercise. A few advice could have changed most of the situations that are present in the hospital as a complication. Up to 80% were at some point social problems. So that's our approach to this question you have asked.
Okay, thank you so much, sir. I'm still trying to note some few things down, but the first point, okay, let me ask from the first point, and our time is actually fast spent, and I would like you to just be precise on this question. You talked about the AI, like the people would have imputed some certain vitals that they should have measured before now. So now we know that for you to measure your temperature, you need a thermometer. For you to measure your blood pressure, you need a blood pressure monitor, the electric one. So what about people that don't have access to these things? And we can't really rule down. So we can't say medicine is only for the rich people. What about the people that don't have access to these things? And then, okay, I don't know if you are jotting this down because I just want to rush the questions to you, and then probably you can help put it in a nutshell in 5 minutes. So you also talked about uh, the USSD, the like you're going to have a USSD code for those that are not internet savvy or they don't have access to the internet. So now look at the current issue that is facing the cryptocurrency industry and the Nigerian government. Will you say will you say the government are actually going to accept this solution, looking at the ban on cryptocurrency at the moment, and also putting in mind those that are in the rural department? And the third one is about the wrong diagnosis due to fatigue of doctors. So now that we are having AI, the AI is not the one that is going to provide the solution. It's still going to be the doctors. The AI is just to give the doctors, okay, this is the symptoms or whatever vitals that the patient has already submitted. So, are you sure? Like, is the when these things are now being sorted out, and the doctor still needs to provide some vital information or some diagnosis and all. How are you still going to blend that up to now say, okay, the doctors are going to find it easier to work with an AI? Over to you, Dr. Ucheche.
Okay, I'll start from your first question. You talked about equipment to measure certain things um, in patients that may not be able to access. You made mention of something like temperature, and you made some mention of something like blood pressure machine. These questions, the you ask are for doctors. I can, any doctor can make a diagnosis of hypertension. Um, you can make a diagnosis of hypertension or suggestive diagnosis of hypertension with some questions. If I ask um, certain questions, I should be able to deduce if this patient is hypertensive. I, what's your body weight? Do you know your last body weight? If you tell me um, you are weighing 110 as a man, and ask you how old you are, you tell me you are 5. Are you having headache here and there? You tell me yes. Have you had difficulty in breathing at some point, or can you lie flat on a pillow? Those of questions, there are preset of questions that every doctor knows to ask is looking for certain conditions. So you may not necessarily need an equipment to say this is exactly what is happening to this client or this patient. So I believe that resolves that part of the question where it doesn't exclude those that cannot afford treatment. As a doctor, you ask questions to point you to a condition or a situation. You don't depend on these equipment to make your diagnosis, even though they are key. What about those that cannot afford those equipment? You have rightly said, and that's the thing. So, as a good doctor, you should be able to ask more and more that will help you with your diagnosis. I we have been to, or you have to be able to improvise. I've been to places where we can't find certain things. You Okay, I'll just leave it at that just for sake of time. The next thing you talked about is as well wrong diagnosis. How is the AI going to help doctors um, with the wrong diagnosis because of fatigue? Uh, the AI is designed to do exactly that. It should be able to put together hostile symptoms and correlate it with several cases that is so in medical journals That was why in my conversation I said evidence based is not something someone will sit down and code one day. The company I'm working with is one of the oldest in the space. They've worked with companies like Pfizer. They've worked with very big pharmaceutical companies that understand um, what what one should look for in a patient. So if you tell your doctor your group of symptoms on the Nimedix platform, this AI algorithm will give you an evidence-based result. Yes, it will give you a diagnosis specifically. It's up to the doctor now to override and say, okay, based on what I am seeing, that's where the human interface is even more important, because there are times what you see might be different from what AI is telling you, can only be suggestive at some point. So you can say, okay, this AI would have been right, this and this were there. So I will not think it's this. I will override the system and say this is the problem. It is less of a job to do for a doctor than have him see hundreds of patients without any assistance at all. I don't know if that answers. Then the last part of the question is the crypto the crypto side of it and the CBN um, saga. Unfortunately, we find ourselves in such an environment that regulations and policies will try to stifle um, um, uh, innovations. At some point, at our first appearance at the Blockchain Nigeria User Group Conference in Abuja, we approached the SEC chairman, Mr. Imotimi. At that time, we explained what we were doing to him. And he said, "See, there are no clear, how do I say it now, legal framework for this cryptocurrency thing. So as long as it stays on your platform, that is fine. We are not saying, okay, you don't need the naira, you need Nimedix coin. Our coin will be used on our platform and will be useful on the blockchain space. So whatever happens with the naira is the naira's problem. So we don't want to interface with the government at that level. And even more as our legal advisor, in person of Barrister David Inoturu, he actually was among the team that put up the legal framework for cryptocurrency startup, the startup bill Buhari just signed. He was part of the team that dropped that. So if we have any legal challenge, I believe such a caliber of person would be able to identify and let us know. So I hope that answers the questions. You were quite fast, so I could only pick three of them.
Okay, we can only try with that. Just manage with that. I would have actually loved to ask more questions, but we just have to draw the curtains here and also give time to those who would like to ask one or two questions. So at this moment, I would like Mr. Gilbert to handle the session of those who would like to ask one or two questions. Over to you, Mr. Gilbert, sir.
Uh, Personally, I have some question, or I should say probing, listening to the discussion. Uh, a couple, I noted some of them. And I know persons in the audience may have their own questions they would like to ask. So I will just be focused on the probing, which I think will be very important. One, you made mention of, for example, the village people example. So if I have maybe some millions of naira I want to give to my people, I could give them access to this health service with a unique link. It does not have to be my village people. A number of persons or a group of persons, we could come together, register a particular link so that when we want to access healthcare through Nimedix, we could use such link.
Okay. Again, thank you for the question. This is what we want to achieve with that feature. Every individual that creates a wallet has a unique identity. So if you want to do certain things, you can't come together as a group, but a group can come together under you. So um, if you want to provide access to healthcare for, if you just want to do for charity, say, okay, I have 1 million naira, I want to pay for healthcare. Um, this is my phone number. Call this phone number and it will patch you through to to the Nimedix platform. So when they get to call the number, when they get to call your number, okay, or you can as well share this unique link to whoever you want to use it. Say if they have a roll call, say okay, they give you their names. For example, they give you their names um, for accountability sake. Say Joshua, John, Paul, and Simon wants to see a doctor, and you share the unique link with them. They all get to call in. We have a record that Joshua, John, Paul, and Simon has called, and they have paid the XYZ amount they were supposed to pay for 10 minutes access talking to a doctor, for 15 minutes access talking to a doctor, and this is what it is. They got their prescriptions, and they should get their drugs if they have ordered from the platform and things like that. So that's we're trying to keep it as simple as possible.
Okay,
So
I get that.
if you have yeah, so if you have a group that wants to do something in that line, all they need to do is to fund your wallet. So they can just send the funds to you. Your account will be built for that.
Okay, but is it possible, group of persons, for example, we have the Smart Investors Lodge, so uh, the Smart Investors, we have a unique link or whatever. I know at the end of the day, each of us may have a unique number, just like you said, but is it possible we have a unique identity so that when a member of maybe the premium community want to access healthcare, one will know this is coming from a particular community or a unique set of persons.
Absolutely. It's like having a corporate profile. You can create a corporate profile and say everybody within this corporate profile can access care, and the bill will be sent to you as the manager of the profile.
Okay. Okay, and then back to insurance. That place really interested me because, first of all, I see that now this is just beyond seeing the doctor and the pharmacy you also made mention of, which means we also have access to health insurance. Or are you making plan for that, or you're it's already there, or you're speaking in futuristic term?
We've done a lot of work. We did some work with Sinso, it's a Chinese company. They have done very well in that aspect in China. They have lots of funds. Uh, so so with the insurance thing, like I said again, we're working with traditional Nigerian healthcare insurance platforms to to come up with that. It's not very easy, policy wise, not technology, policy wise, to come up with something like that. But what we have done, we have just changed healthcare cost to healthcare, sorry, to insurance cost. We've changed insurance cost to insurance investment. So you can make something off your insurance, either than it being a cost. Before now, it has been a cost. You pay that every month or every quarterly or how you see fit. But now we're saying with blockchain technology, you can do that once. I'll just give you an example. Imagine buying, um, imagine using 5 BTC to to pay for an insurance plan 10 years ago. You have made the company rich basically because see what the price of BTC is today. So we believe as a company that in 5 years' time we are going to grow. So if you are going to leave 5,000 naira worth, for example, of your coins untouched for that long time, you should be able to get some benefits off of it. You don't have to pay that over and over and over and over again. If you don't get to use it over time, it should have built into something that when you need it, even if it is huge, it should be able to cover for itself. That's the thinking. And we've done the math behind it as well. It will be in our economics for that plan.
Okay, interesting. I find this interesting, meaning just with my phone, I can have access to healthcare, doctor, and other services, which is very, very interesting. And we've really deliberated much, thinking from the end user at this point. So I know we are smart investors. So it interests me. I would like to know what blockchain is the solution you're bringing into the market being built on.
Okay, we are building on the near protocol blockchain, and our reason for building on the near protocol blockchain um, were both technical and financial. Near Protocol had funded the project. We got a grant from Near to develop part of the project, and also the technology in itself. It's a good technology. Basically, it's eco-friendly. It's an eco-friendly blockchain, and the the transaction fees, we understand we have to hold down cost as much as we can. So transaction fees on Near Protocol is quite minimal. So also ease of doing stuff like NFTs, because we have stuff like bio NFTs we're working on, that will be part of the ecosystem as well. It's it's best, in our opinion, done on the Near Protocol blockchain. And with with the recent madness in the market, I think everyone will understand our decision to go with the Near Protocol. It was it was deliberate because we built on BSC at some point. We had to take it down and go start building on the Near blockchain. And Solana and all the crises and Phantom, most blockchains have shown some sort of weakness, but not the Near protocol. So that's some of the technical, just easy technical reasons we are building on Near protocol, basically.
Okay, to make the most of time, let me see. I think I have two or three more questions. It's important for me, it's very important for me, and I'm sure as well for those who may be listening and are thinking also from my perspective, beyond just being an end user at the end of the day. Do you, what do you have a competition? If there is, we'd like to know the solution you're bringing into the marketplace. Do you have a competitor? Am I heard?
Sorry, say again. I didn't get that.
Okay, I want to know with all of this you're bringing into the marketplace, do you have a competitor, like a competition providing the same
Yeah, yeah.
service?
We, w- um, I'll, will I say competitor? Nimedix is born out of somewhere deep in understanding of the healthcare space. Yes, I got you.
Hello? I think we've missed him. Hope it's not from me, or am I heard? Let me know if you can hear me, if anyone
Mr.
can hear
Gilbert,
me.
I think you're in a matrix.
Me?
Yes, I got your question the first time.
Okay, I think Doc was in the
Can you hear
Matrix,
me?
not me, because I could hear everyone except him.
Yes, we can hear you, doctor. You can go ahead.
Okay.
Okay. Yes, I'd say yes, and I'd say no. Um, where Nimedix came from is deep in understanding. Okay.
Go ahead, doctor.
Okay. Um, we understand the space from which we in which we are building rather, and it's a yes and a no question. Do we have people building similar solutions in the health space? I would say no. as our approach is entirely different. Most solutions out there are patient centric. They are more focused on what the patient can do. And we see the shortcoming with that idea because um, I'll also state again for emphasis, we are over 210 million people with just 30,000 doctors. So even if you build the biggest facility in the world, you still need doctors to run them. So the few doctors we have, what are we doing with them? Most platforms don't build with this thinking in the design, and I think it's a fundamental problem. You can build a telehealth solution, but where are you going to get doctors to put in them? Or how good or how efficient, what is the quality of service you get? So, in that light, yes, we have competitors building something in the blockchain space um, that is looking at healthcare delivery and access. But again, we are unique that we are building something for the doctors as well. We are helping the doctors be better with artificial intelligence. So every doctor is augmented with a clinical decision support system. So you can process a patient more quicker and more accurately than a typical platform. Also, in terms of competition, like I said, how or are we going to build our solution like a fintech solution, just one line of solution and one line of problem? The answer again is no, because issues don't stand alone, or problems in healthcare don't stand alone. There are other issues that exert influence on a particular challenge. We have tried to tackle that from every aspect or from most aspects that will make the platform more fulfilling to use. It has everything in one place. You don't need to have five different applications to do your transactions. So if you so wish, you can have other tokens in your Nimedix wallet is on Near. Near can keep other tokens as well, Near wallet. So it can be your wallet, it can be your healthcare center. You can straight go to your pharmacy. You can stake some funds for your healthcare insurance. So yes, we have competitions, but we don't have competitions. We are quite unique in our own ways.
All right, thank you very much for that feedback. I think to make the most of our time, we'll leave the floor open for questions from the audience. Meanwhile, I saw a hands from Odinaka. I saw Odinaka hand up. So, Mr. Odi, you're free to ask your question. And Mr. John Okoy, I know you have a question.
Mr. John Okoy, I know you have a question.
All right. Thank you very much, Mr. Gilbert. Dr. Tuche, I know I really commend what you guys are doing in the crypto space. I'll say it's really, really innovative and creative as well. But my question is a quick and simple one. What do you guys seek to achieve in the health and medical sector globally, especially for those who are handicapped, like those who are blind, who are deaf, who are dumb, or even people who are even, crippled, how would you be able to make, or how would they be able to make use of this product or services you're providing?
Oh wow, that's a very that's a very sensitive one there. I must accept. My my elder brother is actually hearing impaired. That is, he's deaf, and I have thought of ways where we can reach out to the deaf audience, particularly because of that. But again, we can, but it's extremely difficult to factor all of this in. And to factor all of this in, for the blind, braille, for for the deaf, sign language, the logistics, the tech, and unfortunately, we can't reach out to every of such individuals. But it's a thought. I'm very, very thankful you brought it up again, and we'll look more into what we can do for these two category of, we call them special populations. Um, the hearing impaired, the visually impaired. Some people are physically impaired; they cannot use their mobile and all of that. It's a sensitive one. So thank you for your question. I will note that, and hopefully in the future we would have something for them. But generally, more to what you said, what we want to achieve in the global healthcare space is to provide access to quality care at a lower cost. That's it. Access to quality care at a lower cost. That's just all of it.
All right, thank you.
Okay, Enyi, you could go ahead with your own question. Meanwhile, we have a feedback here from Vincent Eniola. Say, Doctor, you have said well and also touched most important things on my mind. I will wish to have private
Okay,
discussion with you.
anyway, you can go ahead and ask your questions. Anyway, are you there?
Okay, Vincent.
I think he's not. Okay, let me just a moment. I think I saw um a question here. Okay, from Victor, sorry, Vincent Eniola. He said, Doctor, you have said well and also touched most important things on my mind. I I wish to have private discussion with you concerning a health issue I'm facing. Okay, he replied to that he should feel free to reach out. Okay, who else are we having with hands raised? Okay, I think it's just Enyi and I think that's all. So I don't know if Mr. Gilbert has any more questions. Mr. Gilbert, are you there, sir?
Oh yes, I saw other persons who had questions before now. I don't know if we've lost them or if they can still hear us.
Okay, I think Eni has a question. Eni has disappeared.
Yeah, Enyi has the hand raised, so please you can mute your mic and ask your question, please.
And you just unmute your
You're
mic.
muted.
You have to unmute your mic
Okay.
so we can hear you.
Good evening, Doc.
Good evening, Eni.
Yes. I want to ask from the medical point of view. Many like I'm just getting to know about Nimedix. Though I used to see your write up on Facebook, I just read through, but there at least I got the fundamentals and what Nimedix is all about. And if we share this with colleagues and most questions they'll begin to ask, though I don't know if I really get the part of the AI, the how AI will come in play making diagnosis. Medically we say to make a diagnosis, there will be history taking, physical examination, investigations. Then before you can diagnosis, then before you can line with treatment. So for this patient that you are not seeing physically, and maybe from what I got, you're able to obtain maybe few history and maybe some vitals that the patient is able to give to you. So and making clinical diagnosis, you still need physical examination. So how is AI and Nimedix, how is it going to, cover up to that, that part? So that when you give this to maybe fellow colleagues, they'll also be satisfied. So, okay, this thing is working and is achievable. I really want to get that aspect. Thank you.
Okay, thank you very much, Eni. No, don't just unmute your mic. Unmute your mic.
Okay, sir.
Okay. I've been coughing for 2 weeks.
Yes, sir.
I've had drenching night sweats
Yes, sir.
and weight loss more
Yes,
than
sir.
5 kg in the last month
Yes, sir.
with low-grade fever. What's your diagnosis?
Yeah, most likely it's tuberculosis. of tuberculosis.
There it goes. So there are. You, did you examine me physically?
No, 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 sir.
So these are things you could actually deduce from just a few technical questions. You don't have to do physical exam and all of that for some cases, for most
Yes.
cases. And you will also realize that it's also taught in medical school that your history alone should give you 90% of your diagnosis.
Yeah, that is true.
Yeah, so all I need to do is to ask this person more questions and I can make my
Okay.
diagnosis from there.
Yeah.
So the concept of telemedicine is not entirely new and unique to Nimedix. It has been there for years, long, long, long before now. So I hope I answered your question.
Yes, yes, sir. I think I understand now.
Okay, thank you.
Yeah, okay.
All right, thank you, Amy, for that question. And one final word for the smiling Dr. Ochuchi. Yeah, one final question is, what are we doing? What strategies are being put in place for the market acceptance? You know, you can have a good product, this amazing product, but if the market is not accepting it, there is nothing you can do. So, what are the strategies being put in place to make sure that this product is actually getting the acceptance it deserves from the market?
Okay, yeah, this is something I believe in. The
Doctor,
product
please
is
come back
not
with your smile. Please come back with your smile. You crack.
no
We want that smile.
no, it's fine, it's fine. This is it for me. The solution is not looking for a problem, or the Nimedix is not looking for a problem. There is a problem already Nimedix is solving. So market acceptance is the least of the problems, is the least of our worries. If there are 1 million people that needs to talk to a doctor right now, and I can provide a platform where you can make a phone call or make a video call and talk to a doctor, I don't think there is a market problem there. All I need to do is to make them understand, hello, you can do this with this app. You can talk to a doctor with this app. And there you go. So that's one component of it. There's a huge problem that we are solving. So market acceptance is not, we're not looking for problems, basically. So it's a marketing question, but I'll try to respond to it as much as I can. Our head of marketing is not here, but he will know more of the technical terms to use. But we're solving a problem, and there is a ready market of people willing to. Okay, I'll ask you a question. The way I asked Dr. Enyi, Enyi is a doctor. He's training to be a doctor. I know him. Um, I'll ask you the same question. If you can speak to a doctor with 500 naira using your phone and your internet, will you go and queue in the hospital just to talk to a doctor?
Of course not. I won't queue in the hospital just to talk to a doctor. But there's this skepticism that is going around with a lot of people, and so many people are scared of taking risks. You know, like you said, is actually a marketing question. Like not only a marketing question, which is actually going to play a key role in the success of this
Success.
project. Yes. So it's actually going to play a very, very key role in the success of the project. So yes, I know that this thing is good for me, but I'm trying to tell somebody else, and that other person is not seeing the reason to sign up. Like, why are you putting it in my face? Why don't I just walk into the hospital and just get whatever it is I need to get done? Okay, now that aside, and I just remember this other question. I know if we keep going on and on and on, we are not going to leave here, but I promise this is the final one. Now, the market acceptance is one thing. And now the other question is that what if the upon thorough diagnosis, like you have made more research, let's say you've asked the patient and the patient needs to visit a hospital, is there provision provision for referrals. Let's say you need to refer the patient to a better hospital, a hospital has the best facility to take care of that particular patient. Like, let's say a patient that you are trying to diagnose, and then in your examination, you found out that, okay, this patient has cancer. You know, the next person for that patient to see is an oncologist. And with experience, I realized that when specialists handle some kind of a situation, it's very different from when just a general medical doctor handles it. So, is there provision for referrals? Yes, I think that is just the plain language to use. Like provisions for referrals when you find out that what the patient is going through needs an actual physical medical attention.
Yes, absolutely. Absolutely. The question is quite awesome, and it's in our design thinking that once a call comes in, it goes into our triage. In that triage, you speak to a doctor, a general doctor, and as it goes, if he can find a solution for you, fine, it is solved. If along the line he discovers it's something, every doctor is trained to understand this. If I ask certain questions and I discover that, oh, this person is diabetic, and sorry, I've met this diabetic, this man, old man that knows more about diabetics than that knows more about diabetes than me myself. He's just a diabetic, not like he's a doctor or anything. So you meet people that understand their healthcare conditions or what is wrong with them, and you should be able to. What the platform does is when you talk to us, we can tell you, okay, speak to an oncologist, or speak to an endocrinologist, or speak to a rheumatologist. If you don't have one, we can connect you to one on this very platform. Schedule an appointment with this person, or I will schedule an appointment for you to talk to them tomorrow. If there is need for you to see one physically, we can then refer you to a physical hospital. We have relationship with hospitals on ground, especially in Abuja and Lagos. We've spoken to a few hospitals, and they are willing to work with us um, with this exactly. So if I see you, and I think you need to go see a doctor physically, I'll tell you to go visit this hospital with XYZ code you are from. Before you get there, we'll send your records to the doctors there in the hospital so they know you're coming. That's one part of it. Then the second part of it, not long ago, this woman just called me. She called me, her blood pressure was over the roof, and she had no idea. She had never been diagnosed hypertensive. When she told me she measured it and that's what it is, in my mind I like, how are you even walking? I told her, sit down, eh? Don't walk or don't do anything. In fact, don't greet anybody if they talk to you. Just sit where you are. We have to call somebody to tell a doctor to come and see you because that woman could easily even just drop dead or come down with a stroke if something is not done immediately. So we had to call a friend and they made arrangement for an ambulance that moved her to the hospital. So these are the conditions. These are things you see when you just can listen. What people need, what a lot of people need is just a professional ear to say, these are my problems. You need
All
to
right,
drink
thank you.
water.
I'd
You need
actually
to
like to
eat.
take you up from there. Yes, what people need is actually, and I promise this is very, very final one, this is the last one, like a professional ear. Like now, there is this challenge that is going on in the Nigerian medical sector. We have general medical doctors taking on the duty of a specialist. Do you have provision on your platform in which you don't have a general medical doctor trying so hard to solve a problem that is actually meant for a specialist? Because by the time I've seen situations whereby when these general medical doctors are trying to salvage the problem, they're trying to solve the problem, at the end of the day, they get it all messed up that by the time the case now gets to the specialist, all the specialists can just do at that point in time is just to manage whatever it is that is left. So, do you have a provision on your platform to reduce these kind of cases?
Yes, I think what every platform, this is quite sensitive, and I agree with you. I think this is what every platform should do. I always mention the number of professionals we have. We are over 210 million with just 30,000 doctors. Let's keep that in mind. Just 30,000. So to every one doctor, there are like 10,000 or 9,000 people waiting, or possibly we'll see that one doctor. So, to what you said particularly, I'll play a scenario for you. Um, Amy is here. He's in the institution where I trained. In the entire North Central, there was only one dermatologist, just one. And he was treated badly, or rather, not by the institution where he is, but he was tired. He left Nigeria for, I think, the Arab Emirates. Most of our teachers just leave and go outside of the country where they can be at least seen. Because when you talk about remuneration, salaries, ASU is on strike. A lot of people don't even understand. For a consultant in healthcare, for a consultant in the hospital, some of them have to travel. Some of my teachers traveled all the way from. Some came from Just is even near. Some came from ABU to come and give me lecture in Benue. Are we saying that should be free? So that's how scarce some specialties are. Extremely, extremely scarce. In where I train currently, I think um, there is one, there is no neurosurgeon. We have so it's like that. So it's a problem. It's a problem. It's a problem. So what I encourage platforms to do is to have at least one of any specialty, one consultant of any specialty you mention in your app, that you can say, if we offer services in neurology, for instance, one of my teachers is a neurologist. I can reach out to him and say, sir, this is what I have built. This is what my company have built. Are you willing to work with us to see our neurology patient? He's a very nice person. I don't want to mention his name here. He's a very nice person, and he can help us see what he can do. So anytime we have a case that a neurologist should see, we can connect to him and say, okay, talk to this neurologist. So all healthcare platforms similar to Nimedix, this is what my advice usually to them is. Anything you list, have at least one specialist in everything you mention. Because I know from my side that day, my dear, day. So when doctors try to do their best in the field they are not even trained, it's because I'll use a very colloquial term. It choke, matter choke. If you don't try to do your best, sometimes it even gets worse. So
All right, thank
it
you.
may
Thank
look
you so
trivial,
much.
but it's serious.
Okay. But we just
Yeah.
have to go. We just have to go right now because the time is fast spent. We've
We'll
been here.
call it today.
Yes, yes.
Hopefully we'll have him some other day. I know there
Yeah,
are so many questions one still have in mind. So, Doctor, it will be a pleasure to have you over and over again. So, might not just getting to understand what you're doing, we also understand the progress and the roadmap of what you're implementing so far as well.
Absolutely. Thank you very much. I appreciate. And what we will do for the Smart Investors Lodge, we hope to have you as our beta testers. So Ms. Fulfilled can do all the proving she wants and find out everything she wants to find out there.
I
Wow.
hope I bring it so hard for you, doctor.
That's a great place to clap, knowing the Smart Investors Lodge is going to be part of the beta testers for Nimidex.
We'll be happy to have you guys check, because when you get such feedback and such questions and response, it can only come from a community that wants to know how you're doing, what you're doing, and basically that's what we need to grow as a people. if there are challenges, we can fine tune before we go into the broader or the larger market, basically. So any still has questions. Any take my number from the chat session and call me, or just flash me. I'll call you.
Mr. Joy, over to you. I think it's about time we
Okay,
call it a
so
day.
thank you, Mr. Gilbert. Thank you, Dr. Oshushe, for your time. But for any question, I would be personally making provisions for all that before we make the video of this particular AMA session go public. So just take out time to just watch out in your mails, because they're going to be giving snippets on what will happen, and then probably be getting, for those that were not able to get the links to this particular AMA session, will be sending them mails to the preview. They need to preview, and then they will ask their questions, and we'll have the final video will actually include answers to those questions, but it will be in text format. So you are here and listening to this, for like, this is like a first-hand information coming to everyone. So without further ado, I'd like to call it a day and say a very big thank you to Smart Investors Lodge for hosting this Ask Me Anything AMA session with the Nimedix team, even though it's majorly the CEO that is represented here. So we say thank you for honoring our call, and a very big thank you to the Smart Investors team. And with that, I say this is Fulfill Joy signing out and saying good night and have a wonderful night rest.
Good night. Thank you.
Yeah, good night, everyone.
Bye.